Okay, hello. Welcome to my final project for HCA 175. My name is Olivia Fasano, and I will be presenting on long-term care services. And we learned about long-term care, chapter 10, this semester in our textbook. And the reason why I chose to do my research on this was because I feel like long term care is very important, whether or not we really think about it. Eventually, all of us, we're bound to deal with it at one point, whether it's with ourselves or with a family member or loved one. It's important to understand long term care services and the problems within them and the possible solutions for them. And so, yeah, we'll go ahead and cover that. So, what is long term care? So, long term care is a combination of healthcare services offered to those with functional limitations. So when I say functional limitations, I refer to ADL limitations, and ADL stands for activities of daily lives. So things we do every day. So we walk, we eat, we go to the bathroom. So those are all ADLs, and so people with limitations on ADLs can't perform daily activities by themselves or without assistance. So, for example, someone who has a hard time moving, they may need assistance from someone with them or around them, or they use a wheelchair but they need assistance getting up and out of the wheelchair. And that's just an example of what could possibly be one of those limitations. So, long term care is also based off the name, it's expected to be something that it extends for a long period of time, and whether that could be for someone's whole life or it could be for a significant part of one's life. But the goal is to eventually be out of long term care, but it's there for those who do need it. And the unique part about long term care, which differs from short term care, so say I say someone breaks their arm and they have to go to the hospital, they break their arm, go to the hospital, get it fixed, and then recover. With long-term care, it's pretty much throughout it happens for through someone's life. So for each person that requires this type of care, which I will talk about in the next slide, long-term care is unique to that person, is based off of what their needs are and based off what they need from their daily living, and it's coordinated for specifically that person. And that's why it's really interesting to know about. But the the main goal is to offer the patient a better quality of life while maintaining a sense of independence, which means that despite their that patient's limitation or lack of functioning a certain way, these services are there for them to have as normal as a life they can or as happy as a life they can. We'll talk about quality of life in a little bit. But going into the qualifications, so the qualifications is pretty much like what a person needs to um, have or what they need to go through to be considered for a long-term care service. So typically when we think of a long-term care service, we usually think of like a nursing home or a retirement home. And as it is true that um, uh, elderly and people over the age of 65 are um, primarily um, the main client of long-term care services, most elders do not need long-term care services. It's only specific for those over the age of 65 that are limited physically and or mentally. And so physically we know that someone needs to walk, they need help. But what does that have to do with mentally? So mentally it could be somebody who either has Alzheimer's, dementia, and they have special services that is unique to them to help them function in a different type of way. It doesn't have to be physical, but that maybe they can't do it on their own without forgetting or without struggling to remember how to do something. So those are elderly is just one example of a person who can be in a long-term care service. Another person, or another example of a person who can, is someone who's been through a recent injury or an accident or a severe or diagnosis of a severe illness. And that could be like someone who needs long-term care service for specifically rehabilitation or physical therapy or even occupational therapy. And typically those types of people, their service is not lifelong. It is a long-term service, but it is not as long as one would be for in a nursing home because of their elder age limitations. And then another qualification, which is not limited to an age or a gender or anybody, it's more of a special environment of care, which would be someone born with a, um, maybe for example, someone born with a disability, someone who had no control or no say in their medical conditions, such as someone born with Huntington's disease and that are bound to a wheelchair, but they're not um, mentally limited. They are just physically limited. And then, so talking about that and going back to quality of life, holistic care is very important within this type of um, long term and within long term services because as one may have physical or mental aspects of why they cannot they need medical or assisted care, it's very important within this type of service that the spiritual, mental, social aspects are also considered. So, because at the end of the day, like I said, we don't want these people to feel like that they are not in control of their own lives and that they are able to experience things as they would without this limitation that they are dealing with. So, for example, it's very important to understand holistic care in the sense that like someone may feel better and improve more if they're interacting socially in relationships or they have a purpose um, to like in an activity or something that they can or enjoy doing, and that is what creates a better type of long-term care service. So specifically, there I'm going to look at two types of long-term care services. There's definitely more beyond these two categories, but these are the ones I want to focus on and compare. So, community-based versus institutional long-term care services. So, community-based long-term care services are like the part-time, I like to say. So, it's not all the health service that's being delivered is not 24-hour all the person's life or the patient's life as it is in institutional um, long-term care service. So their main goal is to prevent their patient from ever needing to go into institutionalization, um, and hopefully not even need an assisted living. And it's more informal. It doesn't happen in a hospital setting. These services, it happens in a home-like setting or at the patient's home. And primarily these patients are being taken care of by family members or loved ones. And so these services also take away some stress from the family members. And that's very important because we don't want the lives of family members to be affected just because of their the family member that is also limited. These services help with that. And just talking about the financials, um, Title III of the Older American Act is able to finance most of these community-based services that I'll talk about in the next few slides. But they want to that title ensures that um, these people part of this community are medically and nutritionally managed. And Medicare and Medicaid partially cover long-term care services, but they don't cover all of it. So the rest of that has to be covered by individual savings, but that can also be supported by Social Security as well. Okay, so the types of community-based long-term care services. So the first one I want to talk about is home health care. So home health care is the most common, I would say. Not common, but the first one you think of when you think of a community-based long-term care service. So this is when a healthcare professional goes to the patient's home for a period of the day and delivers a service. So that can be just a nurse going there to make sure the patient is taking their medicine, helping with their errands, helping them with their ADL, such as dressing, walking, um, and take some time away from the primary caregiver, which would be like a family member. Or it could be an occupational therapist coming in to help with mobility, or even a vocal or a speech therapist um, to help with maybe like a dementia patient. But all of these services cannot be delivered without the approval of a doctor or a physician, and that is another one of the restrictions by Medicare and Medicaid that is necessary to be considered for this program. Um, but most of these services are there to help with the limited, the ADL limitations. Okay, so for the next few, these are community-based long-term care services that are not necessarily taking place within the patient's home, but it is not a 24-hour service, and or it is not it is based in like a home-like environment. So we'll get to that, but starting with adult daycare. Adult daycare is a place where patients can go for daytime care while their primary caregiver is at work or running errands or doing something they need to do when they can't leave their parent or loved one at home. So this is very common. At least 50% of these adult daycares are occupied by dementia patients. So it's just a place. It's not there's no medical really. There's some that have like nursing care, but most of them are just a place for um, these patients to be monitored. And adult foster care um, is another service. It is not taking place within the patient's own personal home, but it is in the case where the patient can no longer take care of themselves and are living in a new home with other people run by a caregiving family. So typically these people they cannot be home by themselves. They need to have someone taking care of them, but not doesn't necessarily mean they need medical care. So this is like from 1 to 2 ADL limitations. And the people who own the house or they manage other people in this other patients in this service as well. And then a senior center is more of like a local facility that where elders or even like older adults can go and socialize and participate in programs, activities. It's and even some medical based activities or programs such as like education or like counseling. That these places offer that as well, and like they're typically they're typically privately owned. Okay, and then these two services are not necessarily medical services, but they're just assistance to things to add on to. So, home delivered meals, it's a volunteer based service in which food is prepared and sent to senior centers or patients' homes, such as Meals on Wheels. And this is for, again, people who or patients who cannot always cook for themselves. And sometimes there can be problems within this, but we'll talk about that later. And then homemaker services are when a handyman, like minor things like within the house, like something wrong with like the faucet and they need someone to come help repair that is what this service offers. And also even other light housework like chores or cleaning. This is also offered within community-based long-term care services. Okay, so moving on to the institutional long-term care services. This is when the individual can no longer live on their own and they require monitored care. So depending on their um, ADL limitations, the patient has a variety of options of what kind of home they would be placed into, depending again on those ADLs limitations. But it's not as the problem with institutionalization is that it's not as desirable as community-based care because it's not as it doesn't offer as much independence as a community-based care would because they are not living in the patients no longer living in their own home. They are being monitored by non-family members. It's not the most desirable, but in some cases it's necessary. And I'm going to go over the two examples. So starting and go so the two types I'm going over. There's more, but I'll go over just two. So retirement homes is like there's a big stigma behind retirement homes that we all understand or go through, and that being that no one wants to be in a retirement home, that it's not desirable, but it depends on the person, of course. But retirement homes are mostly used on taking care of the patient with their everyday tasks. Typically there's no delivery of medical services with like offered within the home. It's more like it's independent, and it aims to give the patients some type of independence and support by incorporating some activities and socialization. But it does vary by income level. Like for those who cannot afford these retirement homes to live in a retirement home, the government um, has those available for the low income, elderly, or disabled patients, but it may not be as desirable as one that is not low income. And um, these are usually like based like kind of like a a college campus. Like the the residents share laundry rooms. They have a little built-in kitchen in their room, so they have more um, variation for independence on their own. And there is personal care facilities and personal care homes. Typically, they're in between nursing homes and retirement homes, but some do offer medical services and some don't. But we won't talk about that. But nursing homes is where it's a facility where it's designed for people who need assistance with all of their ADL limitations, where they can't do everything on their own. They have to have someone there with them to help them. And so how it works is they have their staff, which is certified and that is managed by a licensed and certified nursing staff and even a therapist or a physician. But everything is more focused on medical care, making sure the patients are maintaining their health and are getting their appropriate rehabilitation, whether or not it's with the occupational therapist, respiratory therapist, speech and language pathologist. It's highly individualized. Like, it varies by each person, but there are problems within these homes. And so we'll talk about that. So we've all heard the stigma that nursing homes are not desirable, no one wants to be in them, long-term care is sad, and as these services aim to not have that happen, it still happens. These people who live in these facilities undergo mental, physical, and these issues within that affect their quality of life. And so, in order to have an efficient um, facility, we need to acknowledge these problems and make sure they don't happen and how we can solve that. Because these services can be very great, but if they're not done right, they're not gonna go very far. So let's talk about the issues. So we have the social aspects, such as loneliness, depression, and then we have food insecurity. Food insecurity um, is when a patient is not meeting all of their nutritional needs in their meals or food. So we can relate that back to Meals on Wheels, as it is a great program. Maybe some of those services or some similar to that service do not give the patients the right amount nutritional value within their meals. Or with food insecurity, they the patients are forced to cook for themselves or not, and don't know how to cook nutritionally because of their limitations or because their lack of aid. And then we have the poor medical care quality, and that can be from, it could vary from even community-based care facilities or institutional facilities, such as the people who are employed there to help their patients are not giving them the best quality of care. And another problem would be slow reaction time. So within these places where patients need aid and they try to contact a nurse or a worker, is reported in some studies that these patients are not being answered to. They're not getting their services, and it's really concerning in the case of emergencies. But the biggest one that is very concerning, that is a issue that should not even exist, but it does, is that some of these long-term care facilities are abusing and neglecting their patients. And at first you don't realize that, but then when you look into it and you research it, they report it. It's reported by either the patients themselves, witnesses, or family members. It's been reported, and it's terrible. But what is causing this to happen? What are the reasons this happens? And it's not saying that these certain things cause this problem. It's more like, what allows this problem to happen? What allows food insecurity to happen? And so looking at that, starting off with food insecurity, um, looking at research and data, it says that food insecurity is more common with low income patients, lower education patients, but it is primarily from limited availability and accessibility. why is that one of the most important things is being nutritious and having the right food, and that not being fulfilled only just makes these problems worse within that patient. And then loneliness is caused by limited social interaction, as some of these care facilities offer great ways to socially bond with other people. That's not always the case. Some patients struggle with that, or they're not always given that because of their certain ADL limitations. Distance from family contributes to that as well. And then the lack of independence, not being able to be themselves or have control of their own lives, can result in depression or loneliness. And then with the abuse or neglect that has been seen, research shows that there is a higher rate of incidence for abuse when there are more beds or more people living within that one care facility. So that can relate to overpopulation. When there's more people, there's more of a high stress environment, which can lead to a more likely chance of abuse occurring. Same with an untrained staff, if or even understaffed, that there's less people working there and more people living there by a significant amount, that can result to a high stress environment, or untrained staff not knowing how to manage these certain illnesses that patients undergo. And then there is poor supervision and regulation. There shouldn't be a way for these people to undergo abuse if there was a better supervision program in place or regulation in place. But let's talk about what we can do to solve this, what we can do to get rid of these problems, these terrible things that happen. So, and we relate this to what causes them. So, if we know with food insecurity, if it's affecting low income, low education patients, we should take the time to focus on improving that population's service. And we should also focus on hiring nutritional experts to be um, leading these programs and making sure that these patients are receiving the right things. And in regards of loneliness, it is all up to the facilities. Should be encouraged that facilities should do everything they can to improve the quality of life of the patients, and that can be solved by asking the patients, asking what they want, what will make them happy, what will make them feel less lonely. And there's solutions that have been proposed by other research and thoughts, and that would be incorporating technology more into these healthcare services or long-term healthcare services, um, by having an assistant help them communicate with family that are distanced. And for the abuse, we know that overpopulation causes a high stress environment and should be looked at and considered, that there should be a limitation to how many beds are in one facility based off of each state, and that there should be a surveillance program in place where someone comes in, makes sure the patients are doing okay, they're happy, they have good care, and they are monitored, and they're getting what they need. And some other research suggested that the physicians should be asking questions regarding their home life and their care, And that's very important. It's shown that statistically, if a doctor asks their patient, "Are you being abused?" they are more likely to stop that and be able to help them. And so that is it. I really enjoyed this. I really feel like there is so much to long-term care services. I think that if we work together to stop these problems and to find solutions and to incorporate that and respect our elders, we will be able to get far places. Because even though people out there, the elderly and people who are not even elderly, they are limited, but they still have holistic meaning. They require holistic care. They also have things beyond physical or mental. They also deserve a great quality of life. They also deserve meaning, and they care for passion. So, thank you for listening to my presentation. I hope you have a good day and a great winter break.